Say hello to Care Manager Sandy. Like so many other care managers in the country, Sandy's job has changed a lot over the last several years. Driven by changes in the healthcare industry, Sandy has seen her role of caring for patients while they're in the hospital expand to coordinating care for large groups of patients, even if they're never admitted to the hospital. Wow, that's a lot of change. As a matter of fact, by 2016, Sandy's hospital will be required to monitor nearly all of their Medicare patients in this way. With so many new patients to manage, Sandy is busy, really busy. The reports she once used to identify which patients needed help just don't work anymore because she has to keep up with so many people. What she really needs is a way to identify the risk severity of each person within the population, understand the type of care each patient will need, help prioritize which patient to reach out to first, and finally, to see how each patient responded to interventions. Luckily for Sandy, her hospital's analytic group has been working on this problem. By working with partners who offer the right blend of data science and business intelligence capabilities, the analytics team has developed a solution they hope will see Sandy feeling a lot better very soon. So how does it work? Let's take a look with Sandy as she begins her day by logging into her dashboard to find out the current status of the hospital's patient population. As Sandy signs into her dashboard, her goal is to quickly identify which of her hospital's attributed patients are in need of care and how to prioritize who to reach out to first. When she looks at her computer screen, she wants to identify which patients are at risk and need assistance, understand how she should prioritize her time, monitor quality performance to make sure the hospital is meeting contract objectives. Sandy appreciates the simplicity of the dashboard and values how quickly and easily she can find what she's looking for. What makes the dashboard even more valuable to Sandy is the ability to dig into any of the information on the screen to gain further insight that better helps her understand how to best care for patients. One important initiative Sandy oversees is the monitoring of patients who fall within very high or high risk categories to make sure that each of these patients has a care plan in place. Patients that fall into these risk categories usually suffer from chronic conditions. Sandy knows that many of her patients are unlikely to participate in care plans, but those that do usually see considerable improvement in their health and a drop in hospital utilization. The Proskriptive dashboard helps Sandy in two ways: by risk stratifying patients and by identifying which patients are more likely to be activated in their own care. Not only does Sandy benefit from this information, hospital administrators can also use the information to track cost and quality measures by population, physician, or even by payer. One way Sandy stays in touch with her patients is to monitor their scheduled visits to the hospital. For example, today she knows that Mr. Johnson has an appointment. Before he arrives at the hospital, Sandy wants to take a look at Mr. Johnson's medical records to make sure that all of his care gaps are attended to while he's in the hospital. To do this, she simply clicks on Mr. Johnson's name to view all of his records since his past visit. In addition, since Proskriptive technology merges claims and hospital data, as well as pharmacy data, Sandy can see which medications Mr. Johnson was prescribed and if he refilled his prescription as expected. With all this information easily available to Sandy, she is able to prompt Mr. Johnson's doctor to watch out for any gaps in the care plan that need attention, as well as sharing risk trend information that might help the doctor to identify emerging problems. Sandy knows that hospital visits are an important part of coordinating patient care and is glad that the dashboard helps her to make sure they get the most out of each visit. It's critically important to make sure that the higher risk patients receive the attention they need, but it's also important to keep an eye on lower risk segments to identify patients with rising risk scores. Sandy is able to review trended risk information for each patient within the population to observe the status of their health and take action when necessary. Sandy spends most of her time finding ways to help individual patients achieve better health outcomes. In order to keep track of the efficacy of her work, Sandy can also view top-level quality and cost measures for her organization. Hospital administrators are able to see the results of Sandy's tailored patient outreach efforts and work with Sandy to find the right intervention approaches for each patient type. Outside of the population health issue, Sandy and hospital administration staff can use Proskriptive plus Yellowfin technology to improve overall care. With so many opportunities for healthcare to do more, a clear, seamless solution is what the doctor ordered. Let Proskriptive's data science and healthcare experience paired with beautiful and easy-to-use Yellowfin dashboards empower how you manage your organization and patient care. When you consider all the challenges out there on a scale of 0 to 10, at what level is your analytics pain point? Let us demo our technology for your biggest headache, and we can show you how to turn that frowny face into a smile.